Okay, today I get to talk to Dr. Alexander Rivkin, MD. He invented the non-surgical nose job. He is a graduate of Yale Med School, is a professor at UCLA, and the owner of Westside Aesthetics in Los Angeles. Dr. Rivkin excels at providing state-of-the-art non-surgical aesthetic procedures that compete with the outcomes of plastic surgery. Doc, g'day.
Hello, how are you? Good to see you.
I'm very well, thank you. Let's be honest about your beautiful blue eyes. Are they real, or have you plastic surgeried them?
They are real. We have not gotten to the point of eye transplants just yet for aesthetic purposes, but probably will.
Well, let me know, because if I could get some baby blues, that'd be amazing. Let's dive straight into it. You can see me clearly, can't you?
Yeah, it's a little grainy.
It's a little grainy, but you're a professional. You'll be able to figure it out. What would you do to my face if I gave you full control over it? Let's go.
Oh boy. You're killing me, because you, okay, here. So it's kind of, okay, now now we're good. Now we're clear. Because it was like a little bit unclear. Okay. You're beautiful just the way you are. Just want you to know that.
Don't get cute with me, Rivkin. I know that you know what you're talking. I know that you can do some amazing things. Let's go.
People usually come to me with kind of like certain concerns.
Right.
But clearly you're doing good. Do you want this like a jawline? You want like a kind of more heft to the old jawline kind of thing with
I could pop a jawline. I could have my nose made more symmetrical. I could do a lot of things. I could have
pretty good. I think your nose is pretty
good. You like it?
Yeah,
thank you.
I think your nose is good.
Well, the reason I know about you is because the woman who did laser on my face, Gabriella Gerby, she's a previous guest on this podcast. She said nobody knows noses like Dr. Rivkin, and that's why I started following you on Instagram, which, by the way, is a joy. It's so nice to see a doctor's office that actually has fun. But yeah, nobody knows noses like you. You came up with the non-surgical nose job. Can you tell me how that kind of came about?
It was pretty well. Okay, so my training is surgical, right? So my training is head and neck surgery, ear, nose, and throat, head and neck surgery, and so so I know. So I've done rhinoplasty. I've done cosmetic procedures, surgical procedures, and so in doing rhinoplasty, I know what I'm looking for to get a good result. And then suddenly all these fillers came out. It was in 2003, 2004. I think it was Restylane first that got FDA approved, and a friend of mine. Okay, so a friend of mine is Armenian, and she's always has been self-conscious about this curve to her nose, right? Mm-hmm. And she was visiting me, and I have these fillers, that we were using for other stuff, like we were filling in nasolabial folds and stuff like that. And I thought, God, I could probably do this. This is probably really easy. Opening her up, taking a chisel to her nose, doing all this surgical stuff. Instead, I can, in 10 minutes, in 1 minute, I can put a little bit of filler here, a little bit of filler here, prop her nose up like that, and she'll be good to go. So we did it, and she was thrilled. She was just like, I could never conceive that in 1 minute or whatever it was, that I've been thinking about this for years and years, and you just fixed it in like a minute. It was so. That was pretty cool. And then,
how long did they last? For instance, your friend who's Armenian, how long did what you did to her nose? How long does that last? You're just using filler and not cutting somebody open.
At the time, it was using filler that lasted about 6 months. Now there's much more long-lasting fillers. I just saw a patient where I was using a filler called Voluma, and I just saw her 3 years later, and she's doing fine. So it depends. And the coolest thing of all, we have permanent fillers now. So I can make, so somebody can do this thing, and I'm not trying to sell it. I really actually think this is really cool. Like, I'm fine with nobody gonna like, people not, I'm not trying to sell this procedure, but I just think it's like, because every day I do it, and every day people like, I see almost every day people cry in my chair, which is like from joy, mind you, not from like, yeah. So
I don't think you have to sell it anyway. It doesn't
No.
seem like you have to sell it. It seems like you're perfectly busy because people like really would love to have this stuff done. So you're not selling it. You don't need to.
And it's because it's amazing. You can do this thing with a temporary filler that's reversible anytime. Sorry.
You're okay.
These hyaluronic acid fillers, if you want to bring them down, you inject some some enzyme in there, and it dissolves them. So you can do a temporary procedure that's dissolvable, and 3 months later bring them back and say, okay, was that amazing? And they say, yeah, it was really amazing. And then switch out to permanent filler, and then do 2 sessions of that. You're done.
Yeah. So what if somebody comes in? I've seen your work, and I've seen the way you can make noses more symmetrical and make the ridge, I suppose you'd call it, like more triangular or angular or something like that. What if people want to have like a Michael Jackson nose? Like, what if they're like, I want to have a smaller nose? Do we need to go in then and then you have surgery? Like, is there a place for surgery and not for the non-invasive?
A lot of times, so the people that come to see me are either people that want to bring the tip up, or they want to camouflage a bump, or they want to lift the bridge of the nose, like with Asian noses or African-American noses, they want to lift the bridge. Or they've had surgery and they have just a nose that looks like it's been operated on with collapse of the cartilage, or, kind of see the outline of the cartilage and stuff like that. So they want to make the nose look less obviously surgical. So these are the kinds of patients that are kind of bread and butter patients for me. If a patient comes in and they already know that this procedure can't physically reduce the nose, but what they also know, because I keep talking about it all the time in the videos, is that when you make a nose straight, it actually looks smaller, right? So you can take a nose with a bump, add to it, make the bump camouflaged, make the nose blend into the rest of the face, and make it look smaller, which I thought was really pretty cool.
That's very cool.
So you're adding to it by making it look smaller, by making the nose blend into the rest of the face. But yeah, when people come in and they've got just noses that need to be reduced, I refer them to my colleagues, and I know some really good rhinoplasty surgeons.
Got it. And then what if somebody comes in and they're like, oh, like, I want this, I don't know, like the jawline or the nose or something. And they're like, I know that there's just something off about it, but I don't know what it is. Do you have a way of like technically figuring it out what needs to be better? Like, how do you figure that out?
Just look at it, honestly. This whole, you'll see plenty of videos on Instagram of people like taking out like all sorts of like complex equipment and like doing all sorts of laser measuring, and like it's all theater, if you can't, as a practitioner, if you can't look at someone's nose and determine what needs to be done right away, maybe you don't have the eye for it. Maybe you just kind of, this is not the thing for you. But it's just, I look at it, and in my mind, I just have already a sense of what's kind of what I want to see. Like mostly I want to see a straight nose, but I don't. I want to see a nose that's also balanced with the chin. So sometimes in making a straight nose, I have to bring the tip out. When I bring the tip out and the chin is back, the nose gets a lot more attention because it's projected out. So a lot of times, so it's kind of funny. The other thing is that when people come in and they say, oh, I have a big nose, or my nose projects too much, I want to make it smaller. My answer a lot of times to that is that you can make it smaller, or I can just bring your chin out with fillers and make it proportional, and then your nose looks smaller. So it's kind of, that's kind of cool too.
Yeah, that's amazing. I want to ask you, when somebody, out of all the Hollywood men, let's just start here. Out of all the men in Hollywood,
oh man,
who's had the best work done?
Jeez, I have no idea.
Because it's the best, right? Because it's the best, so you don't know.
That's the point, right? That's the point. And people come in and they're like, oh, I don't want lip fillers or I don't want Botox. And I can always tell when somebody's had Botox or lip fillers. I'm like, honey, you can't. Believe me.
Right.
Because they get good work done. It's the ones that that miss the mark. So that you can tell, So and then my corollary answer to that is, you don't understand just how many people in this city of Los Angeles have had work done. Like you're walking down the street, you think that these people are, like as their mamas made them, but they're not. People do it all the time.
Yes, and that's kind of what you pride yourself off, isn't it? Is doing work that's natural and doesn't seem to be like overly noticeable, that people are like, well, that's a very good looking person. Little do they know they've had a little bit of work done, a very natural amount.
Yeah. And all the time I have in my people sit in that chair and they're like, okay. And this is very interesting cultural thing that I've never kind of, I kind of understand, but it's kind of still very mysterious to me. They'll sit in the chair and they're like, I'm not supposed to be here. My husband doesn't know. Like this kind of thing. Like my husband really disapproves of this kind of thing. So we need to do something that my husband won't be able to tell. And I'm like, that's weird on so many levels. It's like, what, your husband is in charge of your body? That's kind of strange. Like you want to do something, but your husband doesn't. Like he's just like, oh, I don't like those girls that do Botox. So, he doesn't know that I've been coming to you to do Botox for the last 15 years. And that's like, literally, that's, I see that all the time. And then they go, and then they are like, okay, so when we do, but the best thing is I was injecting. So I was injecting in Bahrain, right? So I'm injecting the Middle East, and I see all these women come through. And some of them are dressed in kind of like partial hijab, and we come to do the injections. And one of them is like, I want this, and this. I'm like, okay. And I want my lips done, okay. But my husband can never know. He can never know. I'm like, okay, that's fine. How much time do we have? Like, is your husband coming back from a trip or something like that? Because I'm curious, like, how much healing time? And she's like, oh, he's in the waiting room. He's waiting for me. Dude, you're killing me.
Right. So that's impossible, right? You can't have work done and walk out of into the waiting room and not have it be noticeable. Surely there's got to be a puffy inflammation point.
Slightly. I think they're still married. I think they're still together. It was successful. Let's say I did it, and then nothing. Our waiting room did not get trashed, so it was good.
Yeah, amazing. I actually hear that Bahrain, that's in Iran, isn't it? Isn't that one of the most, like, where plastic surgery is the most prolific? It's almost, there's more plastic surgery in Iran than there is in Los Angeles. Is that true?
No, that's true about Iran. No, Bahrain is next to Saudi. It's a little tiny country next to Saudi.
Got it.
And so it's a separate place. But yeah, you're right about Iran. There's an immense number of rhinoplasties that happen there specifically, but also cosmetic surgery in general.
Wow. And what is it, do you think, that culturally that people are so ashamed of having plastic surgery done? What is that exactly? It's like they associate it with, the fake looking people, or what is it?
I think they associate it's a moral, they judge people. And they associate it with vanity, and they're saying, oh, that person went through a lot of risk to themselves physically, right? Because there's anesthesia risk and surgical risk and all this kind of stuff, and a lot of expense as well, that they could have been spending their money on something different, and yet they did it on their cells and did it on their face, and that person is vain, that person is shallow, whatever. And then suddenly, and so they go through thinking those things about other people, and then suddenly they hit 40 or 45, and they think, oh my God, I want to do this. Am
Right.
I shallow and and vain? Oh my God. So it's like this whole like silly thing.
Yeah. And is it vanity that makes people want to look their best? I mean, surely looking your best and being vain are two different things.
I mean, I think we're all animals, we're all just like a bunch of monkeys running around, and we want to look better, we want to look good, and it's in
Yeah.
our because here's the thing, right? I talk about Matt. Some of the lectures that I deliver at conferences I talk about non-surgical transgender procedures, and so I talk about femininity and masculinity a lot. And as I talk about that, I think a lot about what makes someone attractive and why, what's the point, stuff like that. And it's hardwired. I mean, it's like it's hardwired within us as human beings to want
Mm.
to optimally reproduce. We look for people who are attractive, who look healthy, and who look fertile, and
Mm.
who look symmetrical, and who look
Yeah.
proportional in their features. And those to our eye are signals that this is someone that we want to mate with. And it's animal. It's not something. And unfortunately, I mean, we can, as human beings in our society, try to make our society much more inclusive, and I think that's really important to do. But I think it's hard to rid ourselves as individuals from a desire to be attractive to other people.
Yeah, that makes a lot of sense. I mean, I think it probably is an association with actually like the people look down upon plastic surgery as they associate it with bad work.
That too, yeah.
They,
No, no,
they associate it with, but you're right. You're right in what you said, but I do think that people are like, they think about the women who look like this,
yeah.
who look shocked all the time and look like they couldn't possibly eat anything or chew anything with those lips. That's what they think about when they think of plastic surgery.
Yeah, that's true. That's true. That's that's true. Because they can tune in. They can tune into the Real Housewives or of like whatever city any day of the week.
Right.
See that in
Yeah.
front of the screen all day long.
Yeah, exactly. I have a bunch of questions from some followers for you, especially in regards to when should I start getting filler? It seems to be, is it good to get it when the fine lines start appearing? Like, is it better to start early in the filler rather than start it later? What do you think on that? What's your opinion?
I think this is a really important point. I've been in practice now for about almost 20 years. And I've had some patients that have been with me fairly regularly for almost 20 years. Those patients are different from the normal population. If they've been getting Botox or Xeomin, Botox, whatever, Dysport, whatever the brand is, if they've been getting it for regularly, they're different. They don't form these kinds of standing lines that a lot of us do. Right? So the more you go like this, the more you form a line here. The more you go like this, the more you form a line here. If your muscles are a little bit weaker and you don't do that much, you don't form those kinds of etched in standing lines. So there is a preventative component to Botox. And so when people, people come in that are relatively young and they ask me about it, and I say, look, there's no moral, there's no moral judgment there should never be any moral judgments about this kind of thing. And I use half doses as preventative doses. They're still moving, they're still natural, nothing, no change. Nobody would ever know they're doing it, but they're preventing the development of these lines in the future. Now, with toxin, that is very much true. And it's true here, it's true for this area, and for this area. For filler, I don't see that as being really true. Filler, I don't think has a preventative function, although other procedures like microneedling or facials or occasional laser, they stimulate collagen growth in skin, and they are good for maintaining kind of skin integrity and maintaining skin quality. That's always nice. But so that's good maintenance. But other than that, I think toxin, of all the things, I think like use of small doses of toxin, like once every maybe 6 months or so, they come in. It's great. Really works well.
Yeah. Okay, got it. So you're saying that like general filler that's not toxic filler shouldn't be used preventatively, or it isn't preventative, but toxic and facials and microneedling and laser is preventative.
Yeah, I think that does work. I mean, filler can be used. I mean, I use filler, in patients that are young for the nose and just for attractiveness sake, for like promotion or for to do whatever. But really not really for preventative.
Got it. So in your 20 years of doing this, which is an amazing amount of time, how has the technology advanced?
Massively. Really massively. First of all, we have many more fillers and many more options for people to choose from, for me to choose from, and for people to choose from. We have 4 different brands of botulinum toxin, and they're a little bit different. They all are very effective, all 4 of them, but they feel a little bit different. So some people prefer one that comes on faster, it's a little stronger, or the other comes on a little slower, maybe it's a little more mellow, whatever, that kind of thing. And then we have fillers, some that are very, very soft for the lips, some that are more firm for the nose or for the chin or for the jaw. And we have one coming out actually at the end of the year that's going to be a big one. It's very firm and it lasts for a very long time. So for the jawline specific, it'll be awesome. So I'm going to be using that for the jaw and for the nose. I'm hoping that it'll routinely last more than 2 years. But yes.
Wow. So yeah.
And also
please go on.
Our understanding of the anatomy of the face and how the face ages has really advanced quite a bit. So we understand more about what happens when we age, how the fat pads shift and shrink, how lines develop, what happens with the ligaments of the face holding things together, and how that changes over time. So it's really cool. So the knowledge is really advanced, and we can target our treatments much more precisely to what's really going on and make things look natural. Because we used to be, people come in, all they would see was these nasolabial lines. They think that this is the only reason they look older, and so and a lot of us wouldn't kind of understand aging, and so they would fill these lines. And so these people who were like clearly older, right? So the rest of their face looked like they were 50, but right here, they looked like they were 17, and it was really bizarre, right?
Yeah.
And so now we've kind of, we've advanced, fortunately.
Yeah. So if somebody has an issue with this part of their face, it's like, well, it's about lifting or helping other parts of the face in order to help that area. Is that correct? That's right. I mean, there's always, it's funny because in our, there's always fashions, right? And so there was a fashion where you can't treat here, you have to treat the cheeks. But there's no absolutes in it's art. What we're doing is art. What we're doing is creative. And so you have to, everybody's different, every patient is different, and you have to treat to the patient. You have to treat to what the issue actually is. So sometimes I'm just doing the cheeks, but a lot of times I do have to fill here because it's not enough. Because if I was to fill the cheeks in some patients enough to where this is like actually lifted up, these cheeks would be way too big. And I wouldn't want that. So you have to do it in a way that's very specific to the patient involved. And then how, are there fashions in what's beautiful and what's not? Have you noticed over time that what was beautiful 20 years ago isn't what's beautiful now? I mean, I know it's certainly true of like eyebrows and makeup and, things that, you can control outwardly, but not, how people are getting. Have you noticed changes there with how people are getting work in order to fit with the fashion of beauty?
To some degree, yes. I mean, one bellwether is the constantly shifting butt size of the Kardashian family.
Oh yeah, amazing, isn't it? Love it.
Up and down and up and down. Where is it today? I don't know. We'll see. But
Yeah, that's obvious. Yeah, that's certainly a fashion, is like little waist, big boobs, big ass. That wasn't true of the 90s. The 90s were those skinny supermodels, and you could say that it's healthier now, but it's also almost less realistic than what it was in the 90s. Like, it's just so mad, isn't it?
Yeah. Oh, that's the thing. It's just it's weird. People follow this kind of like celebrity culture. It's kind of it's bizarre. People follow these individuals and they worship them.
Yeah.
I don't know why, but I think that what I've seen in terms, I mean, I deal with mostly the face, really.
Mm-hmm.
I've seen sharp jawlines. Now that we can do that non-surgically, I've seen sharp jawlines really become something that people are concerned about, something that people really desire. And again, that can be done well, or that can be done not so well, right? And so sometimes you have women who have gotten these kinds of procedures and they're overdone on the jawline, so they've masculinized, right? And that's not a great thing.
Yeah.
Sometimes people want that, and that's okay. And the other thing I've seen, which is really interesting, I think, is gender fluidity. I think that's really interesting. I have patients coming in who don't want the classic thing, right? I mean, I have, people who want to, males who want to look more feminine, females that want to look more masculine, and they want to have this kind of gender fluidity. And I think that's fantastic, because I'm just so happy that the tools I have can make someone feel more like how they feel inside, and that's easy to achieve. And it's not someone walking around. It's not having someone walking around anymore feeling like they're different inside than the world treats them, or from the outside. And that's pretty cool. So I think that's interesting.
It is fascinating. You're like a painter or you're a sculptor. That's what you are.
It's fun. I don't know. I never used to do any of this kind of stuff. That's the funny thing. The closest I ever came to sculpting was when I didn't want to study when I was in school. I would make little like plasticine little figures and put little pins in them and have them fight. My mom would come in and she would squish them, but she would still say that I was some sort of genius artist, which I really wasn't.
That's so. You talked about what you've learned about how faces now age, or how we age. What are the environmental factors that can affect the way that our faces age?
Yeah, I think that's a great question. I think always the sun and smoking are the two. Well, sun, smoking, alcohol are the three biggest ones, right? I mean, those are the ones that I'm not talking about the really obvious ones. Like you really probably, if you want to be attractive, you probably shouldn't do meth. I mean, that's just kind of
yes.
But aside from that being given, the other things I think are, those are the things that really are important. And it's funny because being on Instagram also, you get I think I just put up recently a post about some dude put up a picture of himself with the private parts blocked out, pointing his butt, pointing his butthole at the sun, and the whole thing was oh, I'm gonna when I sun my butthole, it's gonna make me really healthy. That's not the case. That's bizarre, and B, not good for you. So the sun is just, we get enough vitamin, especially in California, but in sunny places, we get enough sun that we need. It's you got to be careful about sun exposure. You got to be careful about smoking. You shouldn't drink. Other environmental toxins, I don't know that it's that there's that much of it. I just don't know that walking around. I mean, there's a little bit. I think if you eliminate the sun, you eliminate such a huge percentage of the damage done to your skin. And I mean, hydration is important, of course. You should drink enough water. And none of us do that. I don't do that. None of us do that enough. But diet wise and, toxin wise, and I think people go overboard in terms of trying to control what they eat and control toxins and all this kind of stuff. And let me just put in one word about a favorite topic of mine. Just, I don't know why, but colonics don't help you. They just don't. I don't know. It's just not something.
I love that you felt compelled to say that. I had one once. It was kind of fun. I didn't think that it would be doing anything for my appearance. I just thought it was a fad of cleaning out the colon, which needed to happen. And your colon probably does a good enough job of that, unless you are predisposed to having colon cancer, genetically.
Yeah.
That's my personal thought. I used to do coffee enemas. That's what I used to do back in the day.
Dude.
Do you hate me? Are you upset?
No. I just think the concept of I've got a cup of coffee right here. I like it going in one direction.
I know what you mean. But it is the coffee high of your life, Doc. I'm telling you.
Really? That's interesting. I didn't know that.
The caffeine hit is incredible. It's not anxiety inducing like drinking caffeine can do. It's like this firm, beautiful high. But I was just like, this is silly. I was 25. Why am I doing this? My colon works perfectly fine. I need to stop doing this. Listen, you're a very handsome guy. I want to know how. Let's talk about you. And have you had some work done? And if you have you done it to yourself?
Okay. So mostly no. Occasionally, so I'll do Botox every once in a while. I'm kind of. Let's see. I think I'm due. Yeah, I'm doing a little bit. So I'm like, this is great. I can examine myself as we speak. I'll do. I've done a couple of times toxin to myself just because then I know it's coming, and so I'm not. No surprise. I'm good with needles going this way. I'm not so good with needles going this way. Right. So
right.
Pain is not my favorite thing. And so I've done myself with toxin where I put the needle up to here and then I go like that, and then that's how it feels. And for some reason, psychologically speaking, that's more. I don't know. I can take it better, but usually I just have my nurses do it. I used to have tear troughs. I used to have hollows underneath here when I was younger. And I did have that filled many, many years ago, and it's still okay, which is crazy. I mean, and this,
wow.
This procedure in particular, I really love because it lasts for such a long time. I mean, this has been at least 7 years, 7 to 10 years. So that's been a really good one. And then, toxin this a long time ago, and then I need more. You don't need. From a professional standpoint of myself, you don't need more, bro. You look perfectly shiny and fine. What are you talking about? Well, and I'm married, and so my wife's not going anywhere, so it's okay. She's
right,
stuck.
but you're getting high. Don't get high on your own supply. You're getting high on your own supply.
That's true.
I have some questions from my listeners. Any suggestions for under eye bags? You just talked about that. Is getting filler under the eye good for the bags?
Yeah, I think it depends on the patient, and it depends on the person. If it's really in bags where it's puffiness, sometimes you have to have that reduced surgically. But if it's a hollow, then you can fill it with filler. And the great thing about this is that it's a fairly simple procedure. it lasts for like forever. I mean, I have I have pictures before and afters of my patients 7 years out, and they're still fine. I mean, depends.
Wow.
Some people 2 years, some people 5 years, 7 years, and it's
Got
reversible
it.
anytime. So even if like a few years down the road, things change, people lose weight, gain weight, whatever it is, and it doesn't look quite right, you can always adjust it with enzyme, which is like that's the ideal thing. Having something last for a super long time that you can still adjust anytime is really cool. So
Yeah, that is really cool. I have marionette lines. Help. Are marionette lines the lines around here?
Yeah.
Where are marionette lines?
Yeah, it's right here.
Oh,
So
here.
these, I mean, that's fillable. Those are easy with filler. Should be easy with filler. You know.
Right.
And
This
the interesting thing about these,
Go on, yeah, please.
is that these are there's ligaments underneath here, and so they are kind of the transition between the chin area and the jowl area, right? And so if there's too much, these are deep, this looks bigger, right? Because there's a contrast. Like this, if this is kind of there's these are empty and this is full, this looks more full because this is empty, because the area next to it is empty. You fill these, this looks smaller because everything blends together. So that's kind of cool. Where if somebody will come in and complain of this, I'll be like, why don't we fill ahead of it and blend it in, and it looks better. So
Got it. Somebody asked, and I just had to put this in here, but why is my penis purple?
I don't know. Why is your penis purple? You should make a song about that, about purple penises, I think.
What about treatments that you do at your office that are good for people on a budget?
Well, one thing we do in our office that are really good for people budget is, so there's a couple of things. Really, aesthetic treatments, Botox is not super expensive, and it's good for prevention. I think, especially since it's per unit, you pay only per unit, especially for people that are younger that want to do prevention. It really doesn't cost very much. There's specials that we run and stuff like that. But, also these kinds of like PRP, microneedling treatments, they're not super pricey. What we have is a thing for people with self-harm scars. And so this is something that for several years now I've been doing. It's called, the program is called Roll Up Your Sleeves. And I do it with an actress, Michelle Worth. We put this program together where people who have self-harm scars can they can come in, and if they qualify in terms of financially, I don't charge them to do whatever I can to reduce those scars.
Oh, wow.
So if the scars are raised, we try to flatten them out. If they're dark, we try to make them lighter, and we just do whatever we can to try to improve those things. Whether, cutting or whatever it is that people do, there's depression. A lot of times it's accompanied by these kinds of behaviors, and it's tough for people because it's in their past and they've moved on, but the scars are still there, and so it's a constant reminder, and they're self-conscious about having people see them and make judgments about them because of these scars, and so it holds them back a lot of times from jobs, from education, and so what we have is a program where if you qualify financially, we treat you for free, and it's been good. We do whatever we can. We can't take them all away sometimes, because when they're white and flat, there's not a lot we can do. But when they're raised, we can flatten them, make them less noticeable. When they're discolored, we can make them lighter. And if they're indented, so like really like deep cuts, and if the scars are indented, we can fill them up and make them flat. Again, camouflage them. So that's been really kind of nice. The program's called Roll Up Your Sleeves, and
Roll Up Your Sleeves. I love that. So what about somebody asked about thread lifts? What do you think of thread lifts?
I'm not, I don't do them.
Mm.
We don't really do threads that much. We do, there's one nurse practitioner in the office that does them. And she does them and they turn out well. I don't do them very much because now I do just basically noses all day long.
Mm.
Um, some people like them. I think there's a little bit of a variability. You have to go to somebody who's really good because um, a bad job with a thread lift can be nuts, can not look not so good, and also can have side effects that are not great. So you have to be careful about who you go to with those. So
Yeah, got it.
so we do them a little bit, but not too much. I used to be really not a fan of them, but then enough people that I trust in the medical community have like them and use them successfully that I think I think it can be done well.
Yeah, got it. I want to find out about you a little bit more and ask you, drop the skincare routine. I want to hear it. Let's go. Hit me.
um, Actually, for a guy, I actually do. Okay, so I'm unusual because I actually do something in the morning and do something at night, which
Wow.
I think,
Revolutionary.
right, for guys, the guys don't usually do
It
that.
is.
I didn't used to do that for a long time
Mm-hmm.
until I felt like I was getting like, decrepit. So I'll use we have there's a line that I have. We have a bunch of different products. There's also a line called Elastin that I think is a very good line. And I what's it called? Retinol. I use within my line. There's a retinol product that I like quite a bit, and that's good because it turns the skin over time. It's a nice it's a nice thing.
How often
So
do you use the retinol?
3 times a week or so at night.
Okay, and then we're using an SPF 50 on your face?
I I should, but I'm
But you,
indoors so much.
I
But
see you're indoors.
I'm indoors all the time, but you can still, I use some. I don't use a 50, but I'll use like I'll use like a 20 or a 20, whatever it is, 30, and it works fine.
If you're inside all the time, surely a 20 would be fine.
I think
Like
so.
even the
I
sun that
mean,
hits you through a window,
yeah, yeah, that's it.
it's got to be a minimal effect. Listen, you're an MD, which means that you don't just know about noses and fillers and all this stuff. You know a lot about. Tell me about your knowledge of the medical field in general. An MD means that you know everything that there is to know, pretty much, or you know a lot about medicine in general. Is that correct?
No.
Don't be scared. Be truthful, because I've seen your stuff on monkeypox and COVID, and you speak up about these things. So I just want to understand what your knowledge is of all this stuff, so that I can ask you more questions.
Well, a lot of people call me an idiot when I post these kinds of things. So I don't
Yeah.
know. I think I know some, but there's some Instagram people that feel they know a lot more. So I don't know.
Oh, I know, mate. Yesterday I posted that walking is good for you, and you wouldn't believe the amount of people. Blah, blah, blah. I was like,
Yeah.
"Are you kidding? What's your problem?" It doesn't matter what you post about, as far as health and well-being is concerned.
Yeah.
People will yell at you from the other side, and it's just ridiculous. But I really appreciate that you do speak up about these things, because it's absolutely fascinating. But please go on, tell me.
My wife. So during COVID, I mean, we're here, we're at home, we got nothing to do, and so during COVID, it's just like there's so much misinformation flying around. I mean, just clear, like, just wrong stuff that people were getting from like politicians and other kinds of idiots. It was really frustrating. So I had my wife and getting through and explaining things was kind of frustrating sometimes, because people just didn't kind of. You had to go in order to really explain something thoroughly. I felt like it's hard to communicate these concepts sometimes, because they're they can be complex, like how the cells interact and all this kind of stuff. So my wife's an architect, and she can draw, and which I cannot. And so I had her do like these kind of like little whiteboard cartoons about how COVID works, how the COVID vaccine works. And
Wow.
so we conceptualized, so we put our 3-year-old in front of the camera and told him to like flip the boards. And I thought that was kind of cool. So that was my one attempt at cartoon explaining.
I
But
love that.
I try, I mean, I don't know. It's just, it's something where it's, I feel like if you have a platform, and like you do as well, if you have a platform, there's so much misinformation out there that it's nice to use your platform to get good information out. And I applaud you for doing that, and try to do some of that myself.
Yeah, I really appreciate your platform. I love all the before and afters of people's faces. And I love the stuff about the information about COVID, monkeypox you recently posted about, which I really appreciated. And every so often you guys do a funny one. And so do more of those because we like them.
Yeah, it's fun. I have a, so it's, but it's, okay, you know what the funniest thing about it is? I'll go to conferences within my field and I walk in and there's all these nurses and, nurse practitioners and docs and stuff like that. And mostly it's the nurses and nurse practitioners because they're the ones that are younger, they're on Instagram and stuff like that. And I walk in and like, they know me. Like, it's weird. Like, they're like, oh my God, it's Rivkin. Oh my God. I'm like, wow. What are you talking about? And they know, and you want to be known if the prospect of being known comes to you, you want to be known, for certain things, maybe. Oh,
yeah.
Wow, he's such a genius. Oh my God, he knows so much. I'm like, oh wow, he's just so dashingly good looking. No, they know me because of the funny videos. They're like, oh,
exactly.
Funny video. And it's like, it's really cool. It's nice.
Yeah, take fame any way it comes, mate. It's all good. Doc, how can we find you and follow you? Where are you on social media?
So I'm in Instagram with Dr. Rivkin and Rivkin Aesthetics, and on TikTok at Rivkin Aesthetics.
I've got to find you.
And what else? Oh yeah, and YouTube.
Okay, great.
I think. So.
And also the website for Westside Aesthetics is?
Yeah, so it's Westside Aesthetics or Rivkin Aesthetics. You can type that in and you'll find it. It's westsideaesthetics.com.
Okay, excellent. Mate, it's been so fun talking to you. I really appreciate your time.
Pleasure. Thanks very much. All right.
Thanks, Doc.
Have a good one.